So, good morning, everybody, and again, thank you to everyone that's doing the right stuff here in Albany County and throughout the Capital District, because we are in this together. And if we don't do this in our control room atmosphere in the five counties, it sets us all back. So, again, to everyone doing the right stuff, thank you. As of today, there's 2,241 positive cases of coronavirus in Albany County, 854 people under mandatory quarantine, a total increase of 12 positive cases since yesterday. Among those new positive cases, there are 3 cases involving healthcare workers, 3 positives from today reported traveling outside of state, 2 had close contact to a positive case, and 4 didn't have a clear source of infection yet. We found out that 1 person previously classified as unknown source of infection has been linked to the Hudson Avenue party, so that brings that total group up to 40 now. And like I've said this before, you see the ripple effect, since what one party can do going forward. And again, I had Sheriff Apple on here yesterday, and we talked about compliance and everything else like that. We got people sending information in today on 4th of July fireworks going on August 1st up in Bern. We got to look at that. There's some type of dance festival up in Hunter Mountain. So we will be putting that through the control room and letting them make them decisions. But again, there's no more than a group of 50 people now that can get together. So to make that clear. There are 82 active cases in Albany County. 7,081 people have completed quarantine. Of those, 2,159 people tested positive for the virus. That's an increase of 17 recoveries so far since yesterday. Some of the good stuff, we're 1 person down in the hospital. We're down to 3 people hospitalized now, 1 person, from yesterday. With the hospitalization rate of 0.13% of those have tested positive, and yesterday the rate was 1.7, so which is good. So 1 individual currently still in the ICU. That's the same as yesterday. Over the last 5 days, the average is of 14.6 new positive cases each day. Yesterday it was 18, so slightly down. Again, I've said this before, everyone should get tested, whether you have symptoms or not, and we'll talk about that a little bit later. Make an appointment at the state testing site at the University at Albany by calling 1-888-364-3065. Also, our mobile testing sites that are still up and running, area code 518-465-4471. Rite Aid site in Colony, you need to go online to make an appointment, so please do that. And Rite Aid site in Colony, please. I actually got 1 question on this from a few, actually 2 or 3 questions. How hard it is. They do make you use a Google app to make the appointment, but it's pretty simple after that. So it's simple. Priority 1 in Gilliland, the antibody testing you can get done there. So again, 518-867-8040. Again, we keep emphasizing, just remember, wear your mask correctly, cough into your arm, clean your hands, and remain 6 feet apart. And we're going to get through this. I was actually out and about at a few things yesterday, and I still see people with the mask under their nose and on their chin. And I think Dr. Whalen has said that more than once on different occasions that you have to wear the mask properly to make it work and under your chin. But I imagine she'll talk about that again. So please wear it correctly. I know I've said this time and time again. We're going to get through this by being partners with one another and helping each other out through these difficult times. As we continue to see an uptick on some of the new cases, I bring us back to Hudson Ave, because one event can set us back. One event can have that ripple effect. One event can make us stagger backwards. And I know the governor's been putting out new guidance, and the SLA's been out, and different people have been out enforcing. These are things we have to watch for going forward. And again, we're in it together, and I'm going to continue to sound like a broken record. We'll get through this by working together. We'll get through this by taking care of one another in a non-confrontational way. I just want to remind everyone, please, if someone's going to argue with you, just walk away. It's not worth it. Take a deep breath, walk away, continue to do the right stuff, and we'll get through it. even though the capital region percentage of positive rate is often the highest in the state right now, Albany County, we've been decreasing slightly since the Hudson Avenue party and other things. But as of 2 days ago, our percent positive was down to 3.4%. A week before that, it was at 3.53%. And just to give you some ideas, about a month ago, we were at 4.4. So we are starting to move back in the right direction. I'm not going to argue with the people that keep putting stuff on Facebook, about the numbers, about people not going into hospitalization. I'm glad Dr. Whalen's here. She can talk about that. I'm not a doctor. I'm not a scientist. All I can just tell you is in front of us and dealing with this crisis, we can do this together. I've said this before, to the negative people, to the people that just want to put negative stuff out there, you can believe in what you want to believe. We can agree to disagree, but we need to work together. We need to continue to work together to get through this. And, I know we can argue the percentage. People aren't going in the hospital. People aren't getting sick. I've said this before. I've said to parents that have told me, oh, yeah, we're just letting all the kids get it. It's not the chicken pox, ma'am. It's not the chicken pox. This virus has a different effect, and thank God, I will say this, thank God no one's passed away. I don't want to jinx ourselves here. And thank God it hasn't really affected children in that way, that age group. But again, until they get an antibody for this, until they get a vaccine, and we find a cure, it's here. Hasn't gone away. Why is our hospitalization rate different than it was 20-some weeks ago? I don't know. I don't know. But it's still here and it's still having its effect. On that age group, 20 to 29-year-old range group has jumped nearly 50 cases in just 1 week, and I'll show you on the dashboard. There were just over 400 positive in that group. Last time we talked about this, so we've gone up that much in just a week, and I talked about it a couple of days ago. Compare that to the 350 positive cases among the 50 to 59-year-olds of yesterday. So when I walk through the smart board, these are a couple of things I'm going to talk about. And again, I'm not trying to scare this population, but as we're doing, travel basketball and travel baseball, football, let me tell you, football is still not a go. I know Pop Warner football is looking to start their season. No. I know the NBA is going to be playing in Orlando. I got text when I said they weren't playing. So, but the travel basketball team that's been in Pennsylvania, that's been in New Hampshire, and the parents that are providing this, listen, the state has come and they've talked to us about it. They're going to be reaching out to these organizations. I don't know what to tell you. Just make sure you're not supposed to travel outside the county. You're not supposed to travel into Saratoga to play basketball. You're not supposed to be playing basketball at all, or lacrosse, or soccer, or any of that stuff. So please do the right thing. So Dr. Whalen's here, so we'll talk about all that stuff. But I just want to go to the age group that I keep talking about, and we identified a long time ago, and you're seeing 451 cases right now. Compare that to the next group that's the closest at 351, 50 to 59. But watching this group too, the 10-year-olds to 19. That's, it's holding fast, but it's still going up. But you have the other groups to worry about. And then you have the 30 to 39, that's at 288. And again, now the governor, and I'm glad the governor's identified this, and he's been pushing it out there the last couple of weeks to talk about that age group of kids that are going out and they're enjoying themselves. And then you can see the total tested positive, the number, and then the positive results. And so far in this county, we had 72,168 people tested. I know the last census, we're a population of 305. I get it. We're probably up to about 320. You do the numbers of people getting tested versus positive. But that's because people have been doing the right stuff. That's because we shut down literally for 14 weeks and everyone stayed home, and we did a good job stopping the virus. And the only way we're going to continue to do this, to continue to open up, as I advocate on these control rooms for gyms and other places and movie theaters to start opening up, is by people continuing to do the right thing. Dr. Whalen.
Thank you, County Executive McCoy. So, we have noticed that our numbers in the last couple of weeks have been a little bit higher, and we're continuing to follow that along. What we know is that we want to do everything that we can to continue community mitigation efforts so that we do not continue to see the numbers go on as we approach fall, as we approach a very important time period where we're trying to consider kids getting back to school. We want to really make sure for the public that people have a strong awareness of how they can protect themselves and their families, and that the behaviors that we've been reinforcing for the past months are more important now than ever. So looking at the statistics that we have for the county, we continue to see the highest number of cases in Albany County in the 12203 area code. It's a densely populated area code, and that is also part of where the outbreak that we've been discussing was, but that zip code has always been our highest numbers. Looking at things in terms of demographics, we continue to see the death data is highest in those above the age of 71, or above the age of 75%. That's 71% of our deaths. And we see 86% of the deaths occur in white residents and 12.1% occur in African American in our population. It's important always to note with these that in order to be included in the statistics, you have to be tested. We continue to aggressively work to make sure that our testing is equitable in Albany County so that everybody that needs a test can get a test. And the message is more important now than ever that if you are concerned about COVID, if you are concerned about a risk, if you've been a contact to a case, you should be tested for COVID. The percent positive, of course, is important to look at. We know that the 5% marker is where we are looking. Sorry, this is taking a minute to load, but that's the 5% in the population is what Governor Cuomo has told us is going to be a critical deciding factor in allowing the schools to be open. So this is a number we continue to track and follow, and it is again incumbent on everyone listening to this message to do the work that they need to do, which is very little. Wearing a mask, social distancing, avoiding large gatherings, and washing your hands frequently to prevent this spread and prevent this from going up. It's not loading, so I'm just going to continue with my remarks. I know that there has been concern from the public, and as the county executive just indicated, people are saying, well, we haven't got that many people in the hospital, and most of the cases that you're identifying aren't sick. A lot of them are asymptomatic, and that is true. I'm not going to deny that or debate that. COVID is a very, very difficult and mysterious illness, and we cannot predict, based on who gets infected with COVID, how serious the illness will become. We know, statistically speaking, in a younger age group, the likelihood is that children and young adults will have a mild illness. However, we are concerned that there have been children, and there was a recent report in the New England Journal of Medicine from the New York State Department of Health about the Kawasaki-like inflammatory response to COVID-19 in children in New York State. It is something that we are concerned about. It is not something that we are willing to take a chance on. So we continue to tell people to do what they need to do. Similarly, we have seen across the country anecdotal reports of young people that have become seriously ill and that have even succumbed to COVID-19. So it is very important for people not to be blithe about the recommendations that we're giving. If we look to other parts of the country, if we look to places where people have not taken the requirements and the mandates and the suggestions and the recommendations to wear masks, we see that those areas of the country are burdened with more severe disease. More severe disease, hospitalization rates are higher. People have surge capacity issues in states like Florida and Texas and Arizona that are very real And what we're doing in New York is trying to prevent against that happening in our communities. And the only way that we can prevent that from happening at this juncture is for people to follow the recommendations. We know this week the schools are getting in their plans to the governor's office for reopening. The 31st is the deadline this Friday for schools to get their plans in. And we've been in contact with a lot of the school districts in Albany County. They are working very hard to try to adhere to the recommendations that the State Department of Health has given to ensure that children are protected and to develop models for children to be able to be both in school and out of school. It's not an easy prospect. It has been very difficult for the schools, and they are working really hard. But what we need to do as a community to protect those kids is to continue to follow the recommendations. If we lax in the recommendations, if we let our guard down, we will see numbers and continue to increase. We will likely see more severity of illness, and we will likely see more hospitalization and deaths. So although it's not currently at the majority of our doorsteps, it is something that all of us need to be mindful of because it could be very quickly. So we continue to reinforce those important public health preventative behaviors.
Thank you, Liza. And again, to just echo what she's saying, that's the main reason on Friday I had the two superintendents come in to talk about what the new world's going to look like in the school system. And a lot of them have had good plans. I know Holy Names is doing both in class, or looking at in class, but definitely online. That's what they did last year, so they might just go to Zoom for a while. It worked for them. You know, CBA worked for them. So I know schools definitely rolled up their sleeves trying to come up with a plan to move it forward. So, but what I want to remind everyone is probably yesterday was the last $600 check, stimulus check everyone got. I know it ends this Friday, July 31st, but most checks were out on Monday, so that's going to be a big hit to the community. It's going to be a hit to a lot of people that have been getting used to that extra $600 of unemployment benefits that's going to expire. So, you know, during these daily briefings the last month, I've been encouraged Congress and the Senate and the President to continue to do something moving forward. We've talked about the stimulus package 5. The governor's done a great job championing for New York State and the impact it's going to have on the state of New York if we don't get relief. And, you know, so this is something that's very important. It's important too, you know, for the benefits moving forward to communities that have been hit very hard by this virus. You know, what we've talked about, the African American communities, Hispanic communities, again, that are might not, in Albany County, we've been fortunate enough that it hasn't had its toll on the death of these communities like other areas around this country, but the hospitalization rate's the highest than any other race here in the county. So that's something we continue to monitor, and that's why we've been doing the mobile testing. You know, because a lot of them have hypertension, diabetes, the underlying health issues in certain communities that we need to address, not just today, continue to address after this crisis to move forward. But again, I'm calling on the President and Congress and them to work with the states across this great nation. We've been in constant contact down with D.C. I have the unfortunate of still being president of County Executives America, so I've dealt with other county executives across this nation, other governors, and saying, you know, look, we all need this. We're all in this together. And the only way we're going to get through this is getting that stimulus package through, which, again, looks like it's going to be a nightmare. And I hate to use the word nightmare because it's really not going to bail us out. It's not going to help us. And I've made no bones about it that we could have a financial impact in this county up to $40 million. You know, the way that the sales tax number hits for the second quarter, what we're predicting for the third, and without that stimulus check, extra check coming in, people are going to stop spending. They're going to slow up what they're doing, and it's going to have more of a ripple effect on us going forward into 2021. And tough decisions got to be made. And not only are we dealing with a health crisis, we're dealing with a financial crisis at the same time, which is tough. And, you know, so again, we'll get through it together, working together as a group versus pointing fingers and saying, hey, we need to be robbing Peter to pay Paul. So we can't be doing that. We need to figure out how we're going to do this and how we're going to look at programs going forward and services, but continue to do the good work that we do here in Albany County. So please, I said, anyone watching this, reach out, call your congressperson, call your senator. I don't care what aisle you're on. Every all hands on deck. It's going to help us. It's going to help us, because then if the state of New York doesn't get bailed out, the governor's going to have to make tough decisions, and it's going to be a ripple effect. It's going to come down to counties. Counties are going to have to make tough decisions, and it's going to be affecting the way we do business for towns, cities, and villages that you'll see in the next couple of months. If things don't go in the right direction, we'll all be crying, I don't want to say bankruptcy, but probably close to it, the way they're going to be operating into the future. And the last thing we need to do is be laying off more people going forward. So, and as you've been seeing, certain mayors and supervisors are already laying people off because of the impact they just took. So again, reach out to whoever you can, but I want to say this is our week 11 challenge with the Albany County Stay Safe. To switch up gears a little bit here, what's your hobby? So the winners, thank you for everything you did to the 10 winners. The theme of staying close and sharing memories. We just put that up on the board there. So thank you for keeping in touch with friends via TikTok. I know that's been a huge success with a lot of people, but please continue to submit your videos and tell us what your new hobbies are. I just want to remind you, our mental health support's available 7 days a week from 8 a.m. to 5 p.m. The number is 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. And as always, the New York State hotline in United Way 211. Thank you.